In this video, I will be discussing with you how you can use Clomid to get pregnant faster. If you are new to my channel, welcome. My name is Ifechukwu Prudensiana Okachuku. I'm a registered nurse, a midwife, and a family planning provider. On my channel, I filmed health-related content, especially family planning and reproductive health. If this is the kind of content you like, please give me a thumbs up, hit the subscribe button, and turn on your notification and join my YouTube family. And to my returning subscribers, I appreciate you. Welcome back. Have you wondered why many women are on Clomid, yet they have not seen any useful results using Clomid or letrozole? Many women are abusing the medication called Clomid. Clomid, as the name clomiphene citrate, is a medication that is used to stimulate and enhance the production of follicle-stimulating hormone and luteinizing hormones to help them or help the woman to ovulate. So now, this medication, the question you will ask yourself is, how am I supposed to take it? When am I supposed to take it? And who is supposed to take it? Now, as I said, the indication is to stimulate the follicle-stimulating hormone and the luteinizing hormones for ovulation. Is to help the woman to ovulate. So now, how do you take this Clomid? Clomid usually comes in 50 milligrams. So it all depends. Your doctor knows best what is good for you because he or she is the one that knows your medical history and what actually he's trying to achieve. So the milligram will differ because some will start with 50 milligrams and later change to 100 milligrams depending, and some will start with initial dose of 100 milligrams. So it all depends on your doctor. This medication is prescription only medicine. What it means is that you are not supposed to buy this medication out of the counter, like the way you buy paracetamol and other medication. This medication, you're not supposed to buy it by yourself. It should be strictly by prescription. And when you're on this medication, the doctor has to monitor you. It's not something that you can just take anyhow. Many of you are abusing Clomid. When you're on Clomid, you're supposed to be on monitoring. They will do a pre-investigation before you start to know the state of your ovaries and the uterus, to know the level of the follicle-stimulating hormone, the luteinizing hormone, and the progesterone. And they will do ultrasound. Then midway to the treatment, they will still repeat these investigations. So when you're taking it on yourself or by yourself, these things, you don't know how to monitor them, and you don't know the reason behind the doctor monitoring your hormones. Do not take this medication out of the counter. Please stop taking this medication. When you take this medication often and on, you are predisposing yourself to a lot of issues. And this medication is not meant for everybody. The people that are supposed to take Clomid and the people who have regular menstrual cycle, but they are not ovulating regularly, or those who have irregular cycle. So actually what this medication does is that it will help to increase the production of follicle-stimulating hormone to enable them ovulate. So it's not meant for everybody. When you are battling with infertility, it's good you talk to your doctor, go to the hospital, find out what is the cause of your infertility and treat it appropriately. Clomid is not just for infertility. If your infertility is as a result of low level of follicle-stimulating hormone and luteinizing hormone, then your doctor will tell you, and he will place you on the milligram that is okay for you. So stop taking the medication by yourself. Stop buying them out of the counter, please. Now, how and when do you start taking the medication? Some of you or some literatures will tell you start on the 2nd day, start on the 5th day. The truth is that for you to start taking Clomid, you should consider your menstrual cycle length. I keep saying this, know your menstrual cycle length. Those that start on the 5th day rather are those that have usually 28 days menstrual cycle. The reason is that the medication is for 5 days. So what they are trying to achieve is that for those who are 28 days cycle, they ovulate like on the 14th day of their cycle. So when you start on the 5th day of your cycle, the medication will finish on the 9th day of your cycle. So the medication should finish 5 days to your ovulation. 5 days to your ovulation. Because if you are 21 days average cycle and you start taking the medication on the 5th day, it means that you will still be taking the medication when you have already ovulated. Because for a 21 days average cycle, you are expected to ovulate on the 7th day of your cycle. So when you start on the 5th day of your cycle to take the Clomid, it means that on the 7th you are likely to ovulate while the medication is still on the 3rd day. Are you seeing it? So you have already ovulated while you are even starting the medication. So you should know your menstrual cycle length. That is why I tell you, know your menstrual cycle length. If you have not watched my video on this, please go and watch it to understand how you can calculate your menstrual cycle length. And then, please tell your doctor. That is why I say it's not something you can just start and be taking. Women differ. It may work for A and it will not work for you. That doesn't mean you have a problem. No. It's the body makeup and what is the cause of your infertility. That doesn't mean that you are bad or something is wrong with you. No. It's just that it doesn't mean for you. It will not work for you. So it's not a must you start on the 5th or on the 2nd day. It is dependent on your cycle length. So you start it so that the medication will finish 5 days to your ovulation day. So now, when do you start having sexual intercourse when you're on Clomid? There is no specific time to have sexual intercourse when you're on Clomid. Ovulation is usually like if you are 28 days cycle, it's on the 14th day. If you are 27 days average cycle length, it's on the 13th day. So, and if you're on 26, it's on the 12th day. So what you are trying to do is that at least 1 to 2 days before ovulation, it's not something that you can like be doing morning and night. You have sexual intercourse morning, afternoon, and night just to achieve. No, it doesn't work. Sperm lasts for about 3 to 5 days in the human body. So you don't need to stress yourself to be having sexual intercourse. A day or 2 days before your ovulation is the best. You don't need to like, I'm ovulating today, well, let me have sex today. No. The ones that are already in there will just go and fertilize the egg. So you don't need to stress yourself on the number of sex you should have while you're on Clomid. Just focus on knowing your menstrual cycle and your ovulation time. That will help you a lot. Now, who are those that are not supposed to take Clomid? If the cause of your infertility is not as a result of reduced number or volume of or level of follicle stimulating hormone and implanting hormone, please, you're not supposed to take Clomid. If you have blocked tubes, if you have endometriosis, if you have fibroid, if you have PCOS, polycystic ovarian syndrome, please speak with your doctor. People with polycystic ovarian syndrome are usually take the drug called letrozole. The doctor will know better the milligram and how we are supposed to take it. It's better off for them. So do not abuse Clomid, please. It's not good. Everybody are not meant to take Clomid. So if the cause of your infertility is not as a result of low level of follicle stimulating hormone, the sex hormone, please speak with your doctor. Before you start any hormonal medication, speak with your doctor. And this medication can cause what you call multiple pregnancy, twins, triplets, quadruplets, quintuplets, and so on, because you have stimulated the ovary to produce lots of follicles, and most of them will grow and mature and rupture. So some people that have multiple pregnancy, some of them are because of hormonal medication. So there will be fertilization of more than one egg. You understand? So speak with your doctor to know. Actually, first of all, what you should find out is the cause of your infertility. So it still boils down to going to the hospital to get yourself evaluated. Talk to your doctor, talk to your pharmacist, and things will be better. Stop taking Clomid. What are the side effects of Clomid? Sometimes you have hot flush, your body will be hotting like it's pepper, you'll be feeling so hot. Sometimes you have lightheadedness, that is why some people, if you have brain tumor or brain issue, you're not supposed to take Clomid, because the function of Clomid starts from the brain by activating the hypothalamus and anterior pituitary gland. So if the brain is already having issue, you're not supposed to take Clomid. It can cause a lot of visual issues like blurred vision and other things. So talk to your doctor. There are a lot of side effects and they will know how to manage it. That is why I said the milligram you're going to take and the one you're going to take will depend on your health status and what the cause of your infertility is. Drainage of the abdomen, sometimes the abdomen will be bloated and a lot of things. And there are ones that are kind of serious, that whenever you see it, please you report to the hospital immediately. Like swelling of the abdomen. Once the abdomen starts swelling or you are having shortness of the breath, please report to the hospital with immediate effect for urgent care. And this medication causes what we call ovarian hyperstimulation syndrome, because you are stimulating the ovary. Now it will start producing lots of follicles, everything, it will be big. So for those who have polycystic ovarian syndrome, as I said before, you do not just need to take this medication. You have to speak with your doctor. If you have thyroid issues, because it has to do with the hormone, the brain is the one working in the production and reducing either hyperproduction or hypoproduction. So all these things is what you're going to put into consideration, fibroids and or whatnot. Find out the cause of your infertility and know how to manage it. Please stop abusing Clomid. Let me know what you think in the comment section. Let me have your ideas, your experience with taking Clomid, and ask your question on the comment section. I'll be there to answer you. If you found this video useful and you would like to have more content like this, please give me a thumbs up. Let me know what you think in the comment section, and please don't forget to hit the subscribe button and turn on your notification for new videos. Until I see you again in my next video, please do take care of yourself and drink plenty of water.